Hey there, welcome to Use the Whole Road Stories of Women in Health IT. Hi, I'm Teresa Youngkin, your host and fellow adventurer on this incredible journey. Imagine cruising down the highway of life and playing that song that makes you sing at the top of your lungs because you feel powerful. When suddenly your GPS reroutes you onto this unexpected path that's filled with twists and turns and detours. But what if those unexpected challenges were actually the key to unlocking your true purpose? This podcast was created so that we as women in community could share stories. Why? Because we want to learn from each other how to elevate our skills, how to get exposed to new innovations, how to be inspired, and how to inspire others. So it doesn't matter if you've been in the industry 2 months or 20 years. I hope these stories will inspire you to create the career that you really want. Welcome to Use the Whole Road podcast, Stories of Women in Health IT. I'm so excited to have Shamekka Marty with me here today. Shamekka and I met at the ONC annual meeting back in December, and she gave me a little piece of her story, and I just knew that she had to be here to talk about her story, who she is, and you will be just as inspired as I was after you hear from her. So, hi, Shamekka, how are you?
I am good after that lovely introduction. Bring you with me on the road. So thank you so much for allowing me to share my story. And look,
You're very welcome. Like I said, I'm sure people are gonna be just as inspired as I was. And if you don't follow her, you need to. Her reels and her posts on Instagram are on point. So, tell me a little bit about yourself, how you got started in this whole health IT journey.
it was like a mixture of a lot of things. Mostly just like I started out, I'll take it way back. My mother, if she were alive today, any gadget that would come out, she had it. She had the internet before people were even talking about the internet. We had everything electronic. People thought we were rich. And I'm like, we live in something that's almost like a trip. But my mom just loves electronics. So she's always spending money to get the latest thing. She's the one that inspired me to always be on top of technology. She used to work remotely and a little hacker herself. So she showed me that. And then also she showed me the other side, which was the stick side. She did have chronic illness. She had lupus, and my grandmother had severe rheumatoid arthritis. So it was that time where I saw where she could make a lot of money and doing things from home way back then, back in the 90s. So I've always had that in me to seek out technology because it's ever changing. That's never going to go away. It's just going to get better, faster. So a part of my life was taking care of people and then learning from my mother. And I had changed my major 50 times when I was in school. I tried to convince myself I wanted to be an accountant. And then I was like, well, let me go to something else. I can't deal with big numbers. Let me go to marketing. What? It's like the same classes? Huh? More numbers? No, I can't do this. Then I had a love of languages and different people. And then my brain started to hurt because I was trying to learn different languages. And I'm like, why don't I go back to my foundation? Why don't I go back to what I really know? And that's IT and healthcare, because that is every day, 365, 24/7. And I went into cybersecurity and then did a lot of caregiving. And I saw the issues that my mom went through where her records were here, her records were there. I'm a patient advocate that mostly advocates for interoperability. And if people are not familiar with interoperability, that's patient access. What does that mean again? When you go to the doctor and you want to have access to your records, you want to read it before the doctor. You want to be able to go to this one specialist and they're on one system, and you go to another specialist on another system. And the two systems do not. We want to help integrate where patient access is interchangeable. You don't have to wait, and you don't have to submit a form and wait and pay per page. Having all of your information at your fingertips. That's interoperability. For a better way to say it, long as breaking it down. So that's what one of the things that I advocate for. So that's why I've been in IT, and no one ever thinks about that. But it's something that you use every time. Everybody in patient at some point in their lives. And I wanted to make things better because it was just back then, I was soaking up the knowledge. My mom was a single mother. I was the one taking her to the doctor, trying to communicate if they would allow me to speak and figure things out and try to put stuff together. And that means like, okay, we didn't have the internet. I had to go in the library. I had to go here. I had to ask the doctor for this. So that's what really drove my passion. And people really don't think about that. But once you get into it, you're like, wow, I can make a difference. I can actually make change. And that's where I met you at.
Exactly. It is. I think to myself, because like my caregiver journey started back in 2001. And I have to tell you that there's still times, and I always say it's a knife in my heart every January when I go to the doctor and I got to fill out paper again because all of this is held electronically. I know that it is. I know that our providers are being paid to keep this data electronically, but I still can't get it from one place to another. And then switching from being a caregiver for my late husband to a caregiver for my children, and now caregivers for my parents and my in laws. And we're still fighting the same fight. And it is so crucial that we have people who are here who are talking about this constantly, not only within the IT realm, but also out to patients because patients have rights as well.
Yeah,
And they need to understand you're supposed to be able to have your data where you need it and when you need it, not necessarily at the convenience of the health system.
correct.
Because as much as it just troubles me, I do like to tell people your time is just as valuable as my time. So when I come into your health system,
Mhm.
I'm not just a piece that gets pushed through this machine or through this assembly line. I'm a human with feelings and I need to go from A to B, but I need you to help me too.
Yeah.
And this should be a lot easier because I get this kind of service in every other area of my life. And I don't know where else I go where I have to wait 45 minutes for somebody to come in to see me if we've got a booked appointment. Even my hairdresser doesn't run that late.
Well, yeah,
Oh,
I understand that people need that time. And I try to, social media, empower patients. Like, try this too. I do want the time. I don't want just 15 minutes when the doctor comes in. But then again, schedule appropriately. They're trying to move people like cattle. And they're just saying, okay, every 15 minutes, but they're not allowing for life to happen. What if you have to let a patient know, hey, unfortunately, you have cancer. We're going to try and do this treatment, blah, blah, blah. You don't just blurt that out. Be like, okay, have a nice day. You need to spend some time. And they're not robots either. So
yeah.
I always try to, if I pick up a tip, I'm telling everybody, like the interoperability space is very much necessary because, like you said, you go to one provider and you go to another provider. The easiest example I can give is whenever I get blood work done, and it's because of one clinician. Maybe my primary care doctor says, you know what, we're going to run some tests, and I want to have my other specialists on alert. Otherwise, if I don't, what will happen is I'll get the test results. Then I have to wait for my primary care doctor to go over this test results with me. Then for him to say, you need to see this specialist, and then go from there. Why delay the process? I know a trick where when you go to get your blood work done, I tell the lab, can you copy my rheumatologist, my dermatologist, my oncologist? And I tell them to copy everybody so that everybody gets the results at the same time and everyone's on the same page. So then when I do see the results and they see the results, I get phone calls from everyone. Hey, did you know your iron is low? We're going to schedule this. And I'm getting that done. No one thinks about that. And it's only because I've been doing this. Um,
I know. And I'm sure that your journey from caregiver now to your primary patient role has changed a lot. I'm sure some of the processes that haven't changed, but just trying to get your treatments. And have you noticed anything easier, more efficient, better now that you're a part of it? And I will grant you that having insider knowledge is priceless. It's not something that should be a secret. It shouldn't be one of those secret societies where only a certain people know how to navigate the healthcare system. So, have you seen improvements because of technology in your treatment? And I want to talk to you about that.
yes. So my caregiver journey actually just ended uh last week. So I was
Oh,
taking care of my uncle for the past 20 years after my mom died. 22 years ago. But with that being said, I do see a very slow progression. And I say that because we should be a lot further. There's other countries that blow us up. Aside from that, when I moved from New Jersey to California, because I'm in California now, I had a binder. And I still have a binder because sometimes when I go into the hospital, it's easier for them to, I just hand them the binder and look at it rather than them scrolling through trying to find different tabs and everything like that. But that was my life before, is trying to organize and put it in a binder. And in the binder, I had sections like, this is for my cardiologist. This is for my rheumatologist. And these are and then after that, little subset labs and treatments and medications I'm on, stuff like that. It's great that now it's on an app, but
Yeah.
for a person with chronic illness, such as myself, I have an app for several different systems. I go to the Mayo Clinic, so I have their app. I go to Stanford, I have their app. I go to John Muir, I have their app. Why do I need 10 different apps? So when I'm sitting at one doctor and he says, oh, I got to find that. And I'll tell him, hold on. And I just show him my phone. Look at this. I shouldn't have to do that. Every time that I go to get certain things done, because I'm a woman, they always ask, what was your last period? I don't have one because I don't have it. But you have to scroll through 10 different things just to find that out. But then if it's a sore subject, it's not a sore subject for me because luckily I did have 3 kids. Then you bringing it up all the time instead of taking the time to look at it. Now you have the information, but you guys don't look at it. I have to tell you. So then it's an overload and there's 50 tabs that you have to pick rather than before where I made it easy and I'd open up this binder and be like, wait, here you go. So it's like the information's there, but it's like an overload. It needs to be a little bit organized, a little bit targeted, where maybe we can just type in like a search thing. Do they have this? So that they can properly zone into things. And perhaps there is, because sometimes I try to peek at Epic, but for some reason, I've seen Epic at 2 different locations. One for my uncle when I was managing his my chart. His my chart looks completely different than my other my chart. So it doesn't mean just because it says my chart that it's a uniform thing. It's actually tailored to whatever hospital system and whatever they pay.
Exactly.
So if they don't pay for all the bells and whistles, it looks completely different. The name has nothing to do with it. And it's the same thing like with ServiceNow or Jira. They tailor it. You don't need all this. So we'll cut that out. We'll just give you what you need. When you go to the salesperson, I need to be able to do business. Great. It's exactly like buying a car. Do you want the expensive version or do you want the economy version?
Exactly.
So that's where I'm like, we're great. We're throwing all this technology out there. It's still not personalized. It's still not interchangeable. And what's the use of having it if we can't make it where it's functional for people who actually use it on an everyday basis? Not, oh, I had a cold or I had this thing and in 2 weeks you're over it. We're not those type of patients. Solve for that. Or the older generation that, yes, it's expected for them to have multiple conditions, diabetes, they have this, they have that. And on top of that, had you tailored it for older people who just aren't with technology? If you're
Yeah.
that grandmother that just has a flip phone, and I know plenty of older people who are just like, I want to deal with everything. I just want to make a call and that's it. They don't want my chart. They don't want all that stuff. Are we thinking about that? Are we solving for that? Because I have yet to hear anything about it. So, yay, we have electronic health records. We have EMR, but we're still not as far as we should. That's where I'm like, these are gaps in the plan. And all we're thinking about now is that little word or the little acronym.
I always say the technology only gets you so far,
Mhm.
right? We still have workflow. We still have problems that we have to solve. I can't just throw technology at it and then it solves the problems because we tried doing that and it didn't work out so good because now we all have 15 portals. I have a portal for my eye doctor. I have a portal for my dentist. I got a portal for my PCP. I got a portal for my GYN. I've got a portal for name it. I have a portal for it. And
Mhm.
I don't even log into them. I'm like, why?
Yeah,
Because I
no,
can. I would spend all my time flipping through things.
chronic
And
illness is a full-time job.
it is. It is. And if we want to be safe out there, because cybersecurity is a real thing and we need to be conscious of it as patients because our data is valuable. And I don't know if many patients even know that, how valuable it is. Even once it's taken, it's been sold. And I've I was touched by a woman who got up and she spoke at a conference that I was at, and she said, I need somebody to do something about this, about these medical record problems. She said, because somebody got my daughter's name and social security number and they keep using it for medical billing and
Mhm.
things like that. She said, my daughter died. So every time I get a bill in the mail, somebody rips open that wound over and over again, every single time. And I don't think that people are cognizant of that or understand how preciously tight that is. I can remember back in the day, you used to protect that your social security number like it was gold. And now we
Mhm.
have to start protecting our health data the same way because it does get taken and it gets used in nefarious ways. And it's
Nobody
really
understands
scary.
that. They always think about, oh my God, my credit card information. You do realize your credit card information has the same information that's on your health record, which is your social security number. So why are you not up in arms about that? Or when I worked at a university and, all of the financial data for assistants is on there. And I said, nothing is locked down. Somebody could hack into us at any point in time. So we had to lock that down. If somebody went onto the campus, our Wi-Fi was completely open. So that's why I was hired to go ahead and protect it, because that's the other thing I do is cybersecurity. But again, if somebody says, oh my God, Capital One was hacked, they start freaking out. Now, if I said Stanford was hacked and they're just like, should I be, should I be concerned? Yes. Now, who would want to pretend to be me? Medical record rise? Go have at it.
Yeah.
Every time they ask me to repeat who you are and your date of birth, and I'm like, can I have another one? Because this one's defective. But all in all, I don't want someone ruining my credit or pretending to be me in other capacities. And we as patients need to start saying something, because if I search something online for some reason, it'll be like, all right, so now everything pops up out of nowhere. I'm like, I just put that in my search and now I think I want it. I don't. So that obviously means something. Or if you visit one doctor, now you're getting all these phone calls and you're wondering why. I know that, like you said in the beginning of our conversation, every year we have to recertify. Basically, nothing's changed, and we have this insurance and the same rigmarole gone through every single year at the beginning of the year. But when we're looking at these things, it's like, where is the paper that says we will not sell your information?
Exactly.
I would like to opt out. They don't put that on there. That's not on that form. I looked at it.
Yes. So as a patient, what would two things you would tell a patient to do to protect their health data?
Make sure that there is some sort of documentation that the clinician has that states they will not resell your information. Then on top of that, when you download their app, because when you're a first time patient, they'll give you the username and login, temporary one, stuff like that. Ask the question. So I just want to make sure, is my data being sent anywhere else? How protected is this? Do we have a two-step authentication system? We have MFA. They're not going to say MFA. I'm saying again, I'm like, I got to remember normal people. Normal people. Um,
Right?
do you have a two-step authentication process to make
Yeah.
sure that it can verify that it's me and not someone over in China or something logging in, that it can recognize that it's logging in from a foreign location, or maybe something set off. Ask if they have any safeguards in place once you do log on to their electronic health records.
Yep. So great pieces of advice. I wholeheartedly agree with you. I think one of my pet peeves is when you get up to the desk and they just give you the pen and the signing pad and they're like, could you have your signature here? And you don't even know what you're signing for or
No,
what you're signing
because
away.
uh, no, I don't even know. Pretty much it's probably a squiggly line at this point. I don't, it's just a pad. You can't even see it. So I'm just, and they just tell me, oh, so by the way, this, and who knows what's on the screen? You will be giving your kidney to someone and you will end up in an ice bath. I can say that. I don't know because I can't see the screen. I'm going by what the person who was paid by the doctor to tell me what it actually said. And then it sends me a copy. Then, not before. Then you have always been taught from day one, don't sign anything that you didn't read. Well, every time you go as a patient, pretty much do that. But
Yep, it's the one place where all the rules seem to be thrown out.
yeah, and it's more
So,
about,
yep, that's it. One of the things I think is really fascinating, tell me a little bit about like you've taken your voice, you found who you are in this world, and you've been broadcasting it, and now you're a thought leader as a patient in this space. Tell me a little bit about your new projects and where you're sitting these days because I see your name everywhere.
I know my husband's saying, "You say no to something, please." And I'm like, "No, honey, I got my
Wonderful.
very high. I'm making up for lost time because it was my voice was heard in a doctor's office. And I said, I want to be a good mom and I want to make sure that I'm there, but still do little things. So that's why I was always putting things out there on social media, making little stupid videos, things that would connect with people. I post my story so that people can see that I'm authentic because the first thing that I always get is, you don't look sick. And I'm like, okay, I know. I don't look my age. I don't look sick. It's a whole bunch of stuff, but don't judge it by its cover. And I saw my mom be so quiet. It was just heartbreaking that it was like, if I spoke, it was one of those things back in the day, you are seen, not heard. So I would have to be like, okay, I can't speak for
Yeah.
her. And she gave me the green light. So now I just take it to a new level. Now that my kids are old, and I said, okay, my youngest is 16. And so he doesn't really need me. As soon as he got his car, I was like, that's when you met me. I was, all right, let's go. And so I'm
Right.
signing up there. And the first thing that I started to do, because I've been doing it for a while, like I said, like low key. And when I
Yeah.
said, all right, now I want to broadcast, everybody knows my name. I joined the Sequoia Project. The Sequoia Project is, for those that do not know, the Sequoia Project is affiliated with the ONC for healthcare IT. And I am a part of their consumer work group, which means I have a whole bunch of people who are very smart that can make change and have a direct connection with the government. So I was one of their patient advocates that helped streamline a lot of changes that the ONC is implementing right now. That is, the ONC is basically the National Healthcare IT Division for the government. Health and Human Services and things of that nature are affiliated with them. And so my voice, they decided because we had several different patients. Every time they asked a question, I was just like, me, right here. So, and it's because I've been like holding it in for years. So it started from there. And then once I spoke in front of, trying to think of his name, Mark Nees, he's a part of the
Yeah.
embassy. I don't know what I
Mhm.
said. I have absolutely no idea what I said. But it struck a chord with him because afterwards, everybody came up to me and he specifically was like, he saw me speaking to someone else after we got done with our panel. And he was like, I'm going to wait over here, but you need to come talk to me. And I was like, okay, sure. And he sat there for almost a half an hour waiting for me. And he said, I want you to come to our ONC meeting in December. And that's when I met you. And then from there, everyone kept asking for my name and information. So I'm signing up for this conference. I'm asking to speak at this conference. And every single conference, like, all right, I'm going to go. If they don't know my name, I'm going to introduce myself. I just started networking like crazy, looking for every different conference that I can get into. And it just exploded. So now we're on part 2 of the consumer work group. And now I've moved from patient advocate to steering committee. So now I'm on steering.
Awesome.
It's just me and the VP of this Sequoia project that are a part of the steering committee. And I'm just striking while the iron is hot right now. And it's a lot of people that have been in the game for a long time that are looking at me like, how did she get there so late? I'm like, you just didn't know my name then, but I've been secretly like laying the
Right.
foundation, planting seed and working and doing my social media. And that also helps is because even when I went to DC, been on the plane so many times, DC like 2 weeks ago, everybody like they went up to me like, I follow you. I follow you. Everybody, I was almost like a celebrity in the sick world that I was taken aback and I said, oh, my voice is being heard. I'm like, that's great. Cause I don't know. Certain people just watch my story. And there's a lot of people that are just like, they don't like to like anything. They just like to look. And I was just amazed.
Exactly.
People just look at my story and actually hear what I have to say, and it's helped them. So me being authentic, I think helped. My latest project
Yeah.
is that I will be speaking at ARM, the annual research meeting about AI and patient voice. I will also be at, I'm trying to think right now because I'm booked for doing things. I just got signed up for DEF CON. That's a cybersecurity
Mhm.
conference in Vegas. I will also be a part of Healthy Voices. That's going to be in New Jersey in September. I know I'm booked out until the end of the year. So
That's
it's a
awesome.
lot. Yes, it's a lot of things. And honestly, my husband doesn't believe me. I do say no, or else I'd be on a plane every single day. Um, but yeah, I'm
I
like,
hear you.
I am trying to make up for a lot of these people started when they were, just they did everything backwards. They had their kids after. I
Yeah.
did it the other way, which thank God I did because I wouldn't have been able to have kids. I I turned a negative into a positive. I was a teen mom. I had my son when I was 16,
Mhm.
my first son. After I had all my kids by before I was 30. My last one was at 27. And so everybody else was like still getting their careers together and everything else. I had just graduated college. I did everything the other way. So now it's okay. They have to remember they need a babysitter and
Yeah.
they have to be home. And I'm like, I can just do whatever.
Yeah.
Now I have the time and the resources. That's the most important. The resources to be able to go to all of these things. I just did a recording a podcast last week. It was a Long Island socialite. She didn't know anything about lupus. I do have lupus and several other autoimmune diseases. And so just educating people because it's surprising how people just don't know unless they know, meaning until it hits them, they don't know about anything else. They just live in this little bubble.
Yeah.
And it's like that. And surprisingly, because I'm relatable due to the fact that I don't look like the part, that they're like, oh, okay, now they're coming out. Oh, it's okay to tell people you're sick. Yes, perfectly fine. Perfectly fine.
Exactly. There is a huge tide that's turning where being sick used to be shameful and it's not anymore because it's an everyday part of everybody's life. How many times do you hear, "Oh, how come this, that, or the other is so prevalent now?" And it's because
People
it's
are
always
talking.
been here. We just never talked about it.
Mm,
And it's not like things are just popping up left and right. Not at all like popcorn. It's always been here, but now we have the freedom to talk about it, which is beautiful because the more we talk about it, the more you find other people who are having the same experience as you, and then you have somebody to relate to, and you don't feel like you're an island unto your own out there. When you have to hide in the dark, that's where shame breeds itself. That
the
makes you
more
just
sickness,
your
better.
mindset. It makes you not feel like you belong. And that I think is one of the loneliest things that can ever happen to another human being is to be somewhere and feel like you're the only person in
And
a
you would
room full of
think
people.
that with this technology that connects people to all over the world, that there would
Yeah.
be less people that feel alone. There's still so many. And I know my mom felt alone because there really was the internet was just starting. I think she had web TV. And again, we were like the first people to have it. How did you get that? So it was the connection portion. And because I speak about it now, again, for my illness, we have spokespeople such as Tony Braxton, Nick Cannon.
Yes.
They only talk about when they have a flare. I talk about it every day. Flare. I like, look, I'm going to go out with you. I look like I'm okay, but please don't walk too fast because I cannot walk fast. Don't let this deceive you. I am really under the breath. So please go slow. And it's just a lot of things where people still message me. I felt so alone. I don't know what to do. Or someone that was young and diagnosed. It still hits them because young people don't know. They don't know anything about sickness. And if they do, it's probably just cancer. Other than that, they still feel so alone. And it's if more people spoke up, they would. So I want to change that narrative, at least and do my part.
I think that's great. It is. I have cousins who've got lupus. It runs in my family. Autoimmune runs all the way through my family in all kinds of in different ways, shapes, forms, all of it as it normally does. And I can remember my cousin at 40 having a stroke because of lupus. You know what I mean? And do you know how devastating that is when you have two little kids and a husband? Then all of a sudden, the career that you had and that you worked so hard for is just gone, just like that. All the
Yeah.
things are just gone. I know for myself, working specifically on a particular app for lupus, like for me, it was important to me because it affected me. I
Mhm.
hope that others who are like in our field, if they have that champion thing of if they've got that one thing that fires them, that they find a project that they can contribute to. But I
Mhm.
know for myself, just for lupus, when we take the app to providers, they're like, "Oh, what does it do? Is it gonna help me in my day?" Things like recording a SLEDAI score, which is so important for a patient, especially to get medications, to get onto an immunosuppressant or to get onto a different medication. It's really important for people to be collecting it, and it all resides in that electronic health record, but like you said, it's this tab, and if I've got 15 minutes, I'm sorry, I'm gonna look at you and say, "How are you feeling?
Mhm.
Let's let's go. How you feeling? What's going on? Let me look at your labs. Oh gosh, did you not get this lab? How come this lab's not resulted?" Which puts the patient in a bad place because all of a sudden you've got all this information dumped on you, and then you're like, "Okay, now I'm gonna have to change my medication and do what?" And then you leave, and then they give you a printout of a piece of paper, and that tells you
They
nothing
don't
of what's
explain anything to you.
happened.
They don't do all the things. They're just like, okay, we'll try this now. You're going to do 2.5 milligrams daily and blah, blah, blah. And then you're out. And I make sure I keep them for as long as I can. I even ask them how they're doing. But for people to like the strangest thing, every single doctor I've ever been to, they have the thinnest walls ever. So HIPAA just doesn't exist. I can hear all of somebody else's business in the next room before they come into my room. But once they're done, I can hear them go get the paper chart or look at their laptop because sometimes they're walking
Yeah,
off their laptops and like quickly just as if you're about to take a test. How before when you were study for a
cram.
test, just like, okay, what are the key questions? Remember this. And that's what they do. So you
Yeah,
expect from me that for the 2 minutes, maybe that you take a look at my chart before you walk in to educate yourself. Okay, let me shift my brain. Who am I looking at now? And she has this is okay, great. So, hi, Miss Marty, how are you doing? And I'm like, you have no idea what you're about to get yourself into because you really did not see my chart.
I
Okay.
absolutely love
Yeah,
that.
like, you have no idea. And then I always get labeled, "You're not the regular patient." I know. So let's go. I need this. And did you look at this? And now it's to the point I can say is I can message my doctor before I get there. I barely have to see my doctors because I am a project manager, both professionally and personally. So I'm always looking like before this call,
And
I message my doctor. I need a new script. I'm not coming to see you so you can give me a new script. So you can just charge me to give me a new script. I need steroids. It's a simple thing. It goes with my kidney transplant. So if I don't take it, I'll die. I don't need you. Just send over a new script. And then they message you back. Okay, we sent over a new script. Done. Now
exactly.
I can do that and not have to before it was always, oh, you have to come in so we can see you. You verify you still need it. No, I need it. We could just skip this whole production. I do like that I can mess with my doctor. And
Yeah.
sometimes I have time. Otherwise, it's no. I need you to look at this. If doctors could have more time and maybe AI will help that, where they
Mhm.
can have an aerial view and not just a whack-a-mole type of mentality. Oh, you came in with this complaint. We beat this one
Yeah,
down. And also now that we give you this medication, two more things pop up. And we couldn't dealt with the other two other things that you probably wanted to talk about. And we're just going in circles,
yeah.
chasing our tails.
I
And I can't stand it. And then the other thing is, like you said, your cousin had a stroke. I had a mini stroke. The only thing that really saves me or sets me apart, besides the knowledge, is the fact that I choose a profession that I can do from home. If I didn't, I wouldn't have a job because
yeah.
my illness is unpredictable. I was in the office one time, and that's when I collapsed in front of everybody. And everyone freaked out because no one knew, because back in that time, it happened 14 years ago, and no one knew I was really sick. So when I
Yeah.
fell and collapsed and was unconscious, everyone was shocked. You know, just like, I didn't want to tell anybody because I didn't want to lose my job, blah, 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 blah. Shouldn't have,
Exactly.
I shouldn't have to live in fear. I'm already in fear because I live with an unpredictable disease. Now you're adding the fear of being
Exactly.
able to put food on the table. You shouldn't have to live like that. So not everybody's thinking about, oh, I should get into IT. Here, if you need a reason why to get into IT, here's a
Exactly.
reason. Because
It
not everybody
is.
wants to be on social security disability. That's basically saying I want to live in poverty.
Poverty. Exactly. Exactly. That's why I got in health IT. When my husband passed away, I was like, I have to do something
Mm.
because I'm going to end up a statistic of being a mother with 3 children at home. And I know what that looks like and I know how that ends and it's not good.
Mm.
And so having to find another way. And again, very circuitous route. No, I never thought I would be here 14 years later, but here I am. I'm very excited about it and I love it and it feeds my passion. And I
Mm.
think that this is one of the things that many women don't know. Real quick, just as a woman of color, because I'm a woman of color, I pass, but it's hard, right? No different. Like I sit in those rooms and sometimes I hear the things and I think, wow, that's interesting. If I looked a little more like my dad than my mom, maybe we wouldn't be having this conversation right now.
Well, look at
So
your name and look at my name. You just said,
yes.
I have to jump through hoops just to sit at the table because my
Ah,
name is not ethnically ambiguous. So for a Black woman in IT, let's just start with sending my resume. I've noticed I didn't get callbacks. I had the same credentials as this person, but I didn't get a callback. Why? Because it says my entire name is Shamekka Marty. So then someone suggests to me, you should just use your initials. As soon as I put my initials SP, uh, then I got calls. So it was just SP Marty. So then all of a sudden I kept getting calls. Is this SP Marty? Yep, yep, yep. And I also sound the part on the phone. But then when I got into the room or on the video call, that would be like,
mm,
do you really know what you say? No. And let's give her a test. And let's do this. And I automatically knew after so many interviews, if the person was white or Black, I would get it. If the person was non-white or Black, I would not get it. And so I had to learn how to get around all of these barriers. And whereas everyone else didn't have to do that. And then once I did get the job, then I had to do 10 times more things just to get a promotion and kiss more butt than usual. And it was constant. So I've been doing this for now almost 20 years. I'm I'm at the point where it's okay. I'm tired. I don't really want to have to do that. I don't want to have to do all of the little minor stuff. I leave that for someone else. Now it's like I get calls every single day. Can you do this? Can you do this? Because I also have an LLC where I do consulting. So I have a main gig and then I consult on the side. And then constantly recruiting companies are calling me, do you want this contract? Now it's to the point where I don't have to do all of the legwork, but it took so long to get here. It actually, I was able to stop maybe 5 years ago.
yeah.
And it shouldn't have to be that way. But now I do see it. When I go to these conferences and they are IT related, if another Black person sees me, I know guaranteed they're going to talk to me and be like, let's think. And I go like, we look out for each other. You come here. You're my new best friend. We're going to be on this conference together. You can literally count on maybe
Yeah.
one again, sometimes two. If it's a really good conference, the only one that I can say is great is Black is Tech. And I go to
Yes.
that. And that's the only one that I can feel like, oh, this is where we all are. But
Every
for
love.
every other
Yeah.
conference, it's just, and especially if it's a girl, usually it's a guy, but there will be like one other girl other than me, and we stick together the whole time. And it shouldn't have to be like,
Tell me, if I was a young Black girl right now looking to get into health IT, what's your advice? Give me 2 pieces of advice.
there's a lot of people that, besides having the life experience, that I come across that have just the education. I think that certain people, half of them that just have the education are just because they think it's something cool to do. And then there's
Yeah.
the other half that a mother, a sister, a brother, or themselves have been impacted and they want to make a change. I think that having some sort of passion and not be just paycheck is the key thing because you're going to see a lot of stuff that is going to affect you and be like, this is wrong. And in order to stay with it so you don't get burned out, I think you have to have a connection. And I believe that everybody, because everyone's sick, there's some way, shape, or form that you could have some connection. It's just equivalent to people wanting to be a nurse. Everybody sees a paycheck. But then once they get into it, they're like, I got to do this. I got to do all this. It's the same thing with healthcare IT. We're touching people in a different way. We're looking at their records in a different way. We're still helping them. But I think that if you want to stay in this, be tech savvy as well as connected. Remember the human side.
Yes.
Because if you remember the human side, you'll get very far and you become passionate. And then your voice will echo in a different way rather than I come across all these doctors, the statistics say blah, 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 blah. Those statistics are tied to people. Are you thinking about the people? Are you really thinking about their feelings? No.
Yeah.
You're just thinking about numbers and science. I want you to think about that, but put it together with we are human. And then that way you'll relax and it won't be like, oh, I did that. I moved on to something else.
I hear you. I hear you. It's definitely, I think that's a piece of gold right there is you got to have some passion behind it because if you don't, it's just a job.
Yes.
Doesn't matter. Doesn't matter what you do.
Yeah. That goes
Any
for any
profession,
job.
any job.
But
Yeah.
when you do healthcare, I come across a lot of people that I'll look at their credentials on LinkedIn and I'm like, wow, when I speak to them, they're strictly by the book. They're
Yes.
healthcare.
Yes.
They're not going to make a change. And I got to convince them as to why we need to do this. So when we go to these conferences as a patient advocate, we aren't properly paid, if at all,
No.
to go out there and speak. But then you showcase all of these great things that you've done in technology to other people who are book healthcare too. And I'm like, I'll show up there like I did at the ONC, some of the little breakout sessions. And I would just pop in there and everybody was all happy. And I would kill their hopes and dreams by coming in. I'm a patient and I was able to come. This sounds nice, but did you think about this? 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 Because as a patient, that's what we really need. And you're like, oh, you need to involve patients. You guys are by the book. You're just thinking of some new shiny toy that you put out and it does all the things, but it doesn't do all the things that help us that we're asking you to. So
Exactly.
that's where I say it's almost like street smart or book smart. It's not street smart. It's sick smart or hospital smart. I don't know how to link
Exactly.
school. Are you down with the hospital? Are you down with the sickness? There is a song about that. Are you down with the sickness? If you're not down with the sickness, then you're not going to get it.
Like it's true. True all the way around. If you
Mm.
haven't sat in an emergency room for long periods of time for people who don't because you don't look sick to pay attention to you,
Mhm.
that's the worst thing in the world.
Yeah, they're like, well,
Because
we have gunshot victims. I'm like,
all day
okay, cool.
long, all day
I
long
get
that you can sit.
yes. I've sat in there one time for 16 hours. And this is when I used to live on the East Coast. And I went to Philadelphia because where I lived in Jersey, like 20 minutes away.
Yeah.
And I knew as soon as I go there, I kept telling my husband, like, yes, but the top doctors are there. I said, yes, but there's gunshot victims and they're going to take them over me. And it got to the point where it was like 10 hours. I said, can we go now? Because we're going to go to the little hospital that's by our house. I know it doesn't have the top docs, but I need to be seen.
Yeah, exactly. Exactly. I have to say that this has been super enlightening. I'm so glad that you're here. I do want to have you back.
I would
So
love to be back. Would love.
you got your voice needs to be heard. It needs to be heard loud. Needs to be heard in different places, not just as a speaker, but in every place because we're all patients. And
Yes.
I need your megaphone out there screaming it to people to remember, even though I don't look sick on the outside, because not everybody does. I'm
Mhm.
sick on the inside. So, Pretty Sick Lupus Chick, where can I find you on all your socials?
And it's pretty much pretty sick lupus chick. The thing is, I got hacked. I'm a cybersecurity and I got hacked, but
No.
doesn't have proper protocols to be able to get your account information back. It's pretty sick lupus chick with a K, and it's all one
Okay.
word on Instagram, TikTok, and Facebook. I'm more on Instagram than anything, and you can find silly videos. Actually, I'm on YouTube at Shamekka Marty. I have a few videos there. I need to start putting some on there. Totally. But you can always find, I try to post every single day. If I'm not posting, check on me. That's all.
Awesome.
My brother
Awesome.
gauges that. He was like, I don't have to call you, but if I don't see a post from you within 24 hours, I know something's wrong.
That's awesome. Thank you very much. And I thank you for your time, your energy, your spirit, and your voice. I'm honored to have you here.
Thank you. And I can't
All
wait
right.
to talk to you again.
Yes, most definitely. I will see you at a conference soon, I'm sure.
Oh,
I'm
yeah.
definitely sure. Remember, we're in this together. Connect with us on Instagram at Real Teresa Youngkin and on LinkedIn for a weekly dose of health IT insights. Until next time, keep blazing your trail because when we use the whole road, there's no limit to what we can achieve.